Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Health Sciences, SOHS. Certificate in General Duty Assistance, CGDA. BHT 002 Basic Needs of Patient Care. Block-1 Patient Hygiene. Unit 1 General Hygiene and Grooming, Clothing. 1.0 Objectives. After studying this unit, you will be able to define health and hygiene. Describe the factor influencing health. Explain importance general grooming and hygiene. Common procedure of maintain general grooming and health. And principles used in dressing, clothing. 1.1 Introduction. As we all maintain health and hygiene in our day-to-day life, the most important aspects in human life is to maintain general grooming and personal hygiene in our daily life to keep ourselves healthy and presentable. To keep yourself healthy as well keeping the patient's good health, GDA should be aware about general health and grooming, basic needs of health and hygiene, factor affecting health, dimension of health, purpose and principles used in keeping patient healthy. This unit will help you to know about meaning of health and hygiene. Dimension of health, principles used in maintain general grooming and hygiene. 1.2 Health and hygiene. General grooming and personal hygiene. Health, as defined by the World Health Organization, WHO, is a state of complete physical, mental and social well-being and not merely absence of disease or infirmity. This definition has been subject to controversy, as it may have limited value for implementation. Health may be defined as the ability to adapt and manage physical, mental and social challenges throughout life. Hygiene may define as the practice or activity that you do to keep things healthy and clean. For example, good oral hygiene includes brushing and cleaning your teeth, and working in a clean kitchen helps promote food hygiene. You have a better chance of staying healthy during flu season and any other time if you practice good personal hygiene, such as washing your hands frequently. 1.2.1 Concept of health. Concepts of health, biomedical concept, holistic concept, psychosocial concept, ecological concept. 1. Biomedical concept. Traditionally, health has been viewed as an absence of disease, and if one has free from disease, then the person was considered healthy. This concept, known as the biomedical concept, has the basis in the germ theory of disease. Enters human body cause illness. Disease microorganism. 2. Criticism of biomedical concept. According to biomedical concept, one factor, i.e. germ, is responsible for illness, but other factors which contribute to the illness are not considered. But it has been seen that some of the health problems such as accidents, nutritional deficiency disorders, mental disorders, disease due to environment pollution also occur. Even germs also get an opportunity to multiply and thereby cause disease. It get appropriate environment inside the body to grow. 3. Ecological concept. The ecologist put forward an attractive hypothesis which viewed health as a dynamic equilibrium between man and his environment. Disease maladjustment of the human organism to environment. The ecological concept raises two issues: imperfect man, imperfect environment. So in the view of ecologists, health problems occur due to environmental pollution or man's maladjustment, or imperfect man environment. Ecologists have considered the external environment of human beings, but internal environment is also responsible for disease, e.g., genetic inheritance, hemophilia, mental retardation. 4. Psychosocial concepts. Health is not only a biomedical phenomenon, but one which is influenced by social, psychological, cultural, economic, and political factors of the people concerned. 5. Holistic concept. The holistic model is a synthesis of all the above concepts. It recognized the stronger of social, economic, political and environmental influences on health. The holistic approach implies that all sectors of society have an effect on health, in particular, agriculture, animal husbandry, food, industry, education, housing, public works, communications and other sectors. The emphasis is on the promotion and protection of health. 1.2.2 Dimensions of health. There are 6 dimensions of health discussed in following section of unit. The dimension of health are physical, mental, social dimensions of health, spiritual, emotional, vocational. Let us discuss in detail. 1. Physical dimensions. Physical health means perfect functioning of the body in which each organ is working in harmony with the maximum capacity. Physical health is achieved by the exercise, healthy diet, adequate rest and sleep and no smoking or alcohol intake. 2. Maintain proper physical health. There is need for taking safety precautions and regular follow-up with the healthcare providers. Signs of physical health: a good complexion, a clean skin, bright eyes, not too fatty, a sweet breath, a good appetite, sound sleep, regular activities of bowels and bladder, smooth, easy, and coordinated bodily movements. 2. Mental dimensions. Mental health is a state of balance between body and mind. Earlier the body and mind were considered two separate entities, but these are interrelated as physical illness can result mental illness and vice versa. How mental illness influence physical health? Mental illness lead to depression, poor nutrition intake, poor hygiene, which further leads to physical illness prone to infection, decreased immune system. Characteristics of mentally healthy person. Mentally healthy person will be capable of making personal and social adjustment. Mentally healthy person is free from internal conflicts, faces problems and tries to solve them intelligently. He has good self-control, balances rationally and emotionally. He knows himself, his needs, problems and goals. He has strong sense of self-esteem. He searches for identity. He lives a well-balanced life, means able to maintain the balance between work, rest and recreation. 3. Social dimensions. An individual is socially healthy if he is able to maintain harmonious relationship with other members of society in which he lives. Social health rooted in positive marseed environment and positive human environment which is concerned with the social network of the individual. The social dimensions of health includes communication, intimacy, respect, equality, social functioning. 4. Spiritual dimensions. Spirituality means in touch with deeper self and exploration, the purpose of life, as people believe in some force that transcend physiology and psychology of human beings. It includes love, charity, purpose, principles, ethics, integrity, hope of life. Meditations, prayers, or spiritual gatherings are organized to maintain spiritual health. 5. Emotional dimensions. Emotional health is closely related to the mental health and is considered as an important element of health. Mental and emotional aspects of health are now viewed as two separate entities for human life. Cognition is related to the mental health, whereas emotional health is related to the feelings of a person. Emotional health includes, an emotionally healthy person has a positive thinking and is capable of coping and adjusting self. An emotionally healthy person participates in all the activities which are related to personal growth and his self-esteem. Emotionally well people have the ability to express feelings freely and manage feelings effectively. They are also aware of and accept a wide range of feelings in themselves and others. 6. Vocational dimension. The choice of profession, job satisfaction, career ambitions and personal performance are all important components of this dimension. To be occupationally well, a person is ultimately doing exactly with what they want to do in life and are comfortable with their future plans. Vocational dimension of health can be assessed by assessing the satisfaction level at job facilities attached to the job, behavior of the management and administrator and of colleagues at job. 1.2.3 Factors influences health. 6 Essential factors that influences individual's health. Health is influenced by a number of factors which exist within the individual and the society. The important factors which determine health are 1. Heredity, 2. Environment, 3. Lifestyle, 4. Socio-economic conditions, 5. Health services, 6. Health-related systems. 1. Heredity. Genes determine the health of an individual from the moment of conception. The genetic makeup cannot be altered. Some diseases like diabetes and mental retardation have genetic origin, so the health of an individual depends on his genetic constitution. 2. Environment. Diseases are caused by changes in environment like air, water, climate, etc. Environment is of two types, internal and external. Internal environment relates to each and every tissue, organ and system of the body and their harmonious functioning. External environment is the physical, biological and psychological components to which an individual is exposed. Environment has a direct influence on the physical, mental and social well-being of an individual. 3. Lifestyle. It means the way people live. It includes culture, behavior and also habits like smoking and alcoholism. A number of diseases like heart diseases, cancer and diabetes are related to lifestyle. Good life. Style like taking healthy food, proper sleep and daily exercise promotes better health. 4. Socioeconomic conditions. They include income, education, nutrition, employment and housing. Income. Rich people have a capacity to seek better medical care, so they are healthy. But rich people are inactive and sedentary, so they are prone for heart diseases, diabetes and obesity. Education. Education, especially female education, has an influence on health. Education helps people to understand the importance of clean environment and maintaining good health. If female is educated, then she is able to educate whole family for healthy habits. Nutrition. Starvation has an adverse effect on health. Good nutrition is essential for normal growth and also for resistance against infection. Occupation. Employment provides income. Employed people enjoy good health. Due to lack of income, unemployed people do not have access to health care. Health services. The aim of health and family welfare services is to treat diseases, prevent illness and promotion of health. Health services like safe water supply and immunization prevent a variety of diseases. Other health-related systems, they include agriculture, education, industry and rural development. They have an impact on health by raising the standards of living. 1.3 General grooming. General grooming, also known as personal hygiene or personal care, consists of nail and hair care, foot care and keeping the body clean so that germs do not spread. Grooming involves taking care of the hair and fingernails. General grooming and personal hygiene are responsible for making the person feel and look good, and both of these are crucial for the emotional as well as the physical well-being of a person. Clothing is also a part of grooming. General grooming and hygiene includes oral hygiene, care of mouth, performing bed bath, care of hair, care of nails, care of foot, genital hygiene, rest and sleep, care of mouth. Definition. Mouth care. Oral care is defined as the scientific care of teeth and mouth. Purpose. 1. To keep the mucosa clean, soft, moist and intact. 2. To keep the teeth and gums in good condition. 3. To keep the oral cavity free from bad odor. 4. To stimulate appetite. 5. To prevent infection and tooth decay. Bed bath. Definition. It is a method of cleaning the body. Purpose. 1. To keep the skin clean. 2. To stimulate circulation and thereby increase elimination through skin. 3. To promote muscle relaxations and induced restfulness. Care of hair. Definition. Hair washing defines that is one of general care provided to a client who cannot clean the hair by himself or herself. Purpose. 1. To maintain cleanliness of hair. 2. To promote comfort and stimulate circulation of scalp. 3. To prevent matting. 4. To observe condition of the scalp. 5. To give a well-groomed appearance and feeling of well-being. Care of nails. Definition. Nail cutting of the care of the client, care and general care for personal hygiene is to cut nails on hands and foots. Purpose. 1. To promote personal hygiene for the person. 2. To enhances the general appearance of the client. 3. To protect against infection which may result from scratching the body surface with dirty nails or from eating food. 4. To remove the dirt and microorganisms lodged beneath fingernails, which may be a constant source of danger to a patient. Care of hands and feet. Care of hands and feet can be given to the client during the morning or at another convenient time. Purpose. 1. Notice the general and physical condition that may place the client at risk for infection. 2. Prevent interruption during the procedure. 3. Soak in warm water to soften nails and foreign particles. 4. Prevent spread of microorganism. Genital hygiene. Definition. Perineal care is bathing the genitalia and surrounding area. Proper assessment and care of the genitalia area will need professional clinical judgment. Purpose. 1. To keep cleanliness and prevent from infection in perineal area. 2. To make him/her comfortable. Rest and sleep. Rest and sleep in hospital. Some patients find it difficult to rest and sleep in hospital. Having other people around, noise from patients or noise from machines on the ward, can make it very difficult to relax. Respect the patient's need to rest and sleep, as rest and sleep is an important part of recovery, so please be considerate of the needs of your patients, especially if they choose to rest or sleep at different times. The main lights may turned off and turn off TV. Other patient may use the headphones provided. Please talk quietly at night time. Reduce noise from mobile phones. It is recognized that patients use their mobile phones whilst in hospital. For some, this is an important part of keeping in touch with loved ones. Relaxation techniques. Deep breathing. Ask the patient to close their eyes and try taking deep, slow breaths, making each breath even deeper than the last. Concentrate on breathing slowly in a regular rhythm. Fill up the whole of their lungs with air, without forcing. Imagine you're filling up a bottle, so that lungs fill from the bottom. Breathe in through nose and out through mouth. Breathe in slowly and regularly, counting from 1 to 5. Don't worry if they can't reach 5 at first, then let the breath escape slowly, counting from 1 to 5. Keep doing this until patient feel calm. Breathe without pausing or holding their breath. Ask patient to practice this relaxed breathing for 3 to 5 minutes. 1.4 Principles while dressing, undressing. Following are the essential areas of dressing and undressing procedure. You used to identify the different types of hospital wear. Manage the personal belongings of the patient. Maintain the personal hygiene of the patient while wearing hospital clothing. Assisting a patient while clothing. Follow principles of clothing. Maintaining the privacy and dignity of the patient. Maintain hygiene of clothings. During the stay in the hospital, patients might be unable to manage their own clothing needs. In some cases, the patient is too weak to dress up. Also, a patient undergoing different medical procedures needs to wear clothes designed specifically for that procedure. Therefore, correct clothing of a patient is very essential. As a general duty assistant, it is your duty to assist the patient in dressing. In case the patient is very weak, you must dress him/her yourself. But for this, you must know the different types of hospital garments, the procedure to dress a patient, precautions to be taken, and the steps to maintain clothing hygiene. Present unit will help you to learn all the above aspects. The type of clothing a patient must wear depends on the needs of the patient. In many cases, the clothes worn by a patient are designed based on the body area that needs to be examined. The most common type of hospital clothing used for patient in a hospital gown. Based on the need of the patient, hospital gowns are classified as basic hospital gown, isolation gown, toddler gown, nursing gown, basic hospital gown. This is the most common type of hospital gown and is used for patients whose upper body has to be examined. These gowns can be worn on the patient's regular clothes and are very roomy and comfortable. Isolation gown. Isolation gowns are used by patients who need extra protection. In patients where there is secretion of body fluids or if the patient's body is sensitive to infections, isolation gowns are the ideal choice. Toddler gown. Toddler gowns are designed for children and typically printed with popular cartoons and images. They are meant to make the child comfortable and cheerful. Nursing gown. Nursing gown is a special type of gown that is designed to facilitate the feeding of the child by a nursing mother. Assisting a patient while clothing. The clothes normally worn by a person in day-to-day life are different from those worn by a patient in the hospital. These clothes are specifically designed for the comfort of the patient and to facilitate medical procedures. In many situations, patients are too weak to change clothes by themselves. In such cases, you should assist the patient in clothing rather than dressing them up yourself. By doing this, the patient will gain confidence in going about their daily activities, and this will help in the speedy recovery of the patient. While changing the clothes of the patient, it is important for you to maintain the privacy and dignity of the patient. Once the soiled clothes are removed, they should be cleared from the room and sent for cleaning. Principles of clothing. One of the most important principles of clothing is to prevent any injury or discomfort to the patient while clothing him or her. Check with the doctor or the nurse with respect to the type of clothing that needs to be worn by a patient. Always instruct the patient before you actually dress him or her up. Before you start to change the clothes of a patient, describe the process that would be followed and explain what needs to be done while changing their clothes. For patients who have suffered a stroke, one side of the body may be weak. Instruct such patients to undress the weak part first. While putting on a dress, it should be put on from the strong side first. You will need to put a sweater on the patient too to keep warm, as poor blood circulation could make the patient cold. Try and make the patients wear their clothes themselves. This will help them manage their activities on their own. Maintaining the privacy and dignity of the patient. Maintaining the patient's privacy is a very important point to be kept in mind while dressing the patient. Some patients may not be able to dress by themselves. You, as a general duty assistant, must take care of the following points. While dressing the patient, you need to gather the patient's clothes. Make sure you get all the undergarments such as underwear, vests, briefs and socks. If patients are able to, then let them choose what they would like to wear. If they cannot choose for themselves, then you need to pick clothes that are free of holes, and those with proper buttons and zippers. You may dress the patient in the covered cubicle. When you do so, make sure you close the door for privacy or put the screen. Even if the patient has a private room, close the bathroom door when the patient is inside the bathroom. This is to maintain the patient's dignity. Many a times, you may have to dress the patient while they are on bed or sitting on the bed. Before you start to dress the patient, make sure you draw the curtains to maintain privacy. If the patient wears an adult brief, make sure you put this on first. This is another aspect of dignity. Put on the socks or stockings on the patient, then the vests, and then put on the top layer of clothes. Make sure you dress the patient the same way you would dress yourself. Remember to maintain the patient's dignity at all times. Managing personal clothing and needs of the patient. You must always give the patient a choice on the clothes they like to wear. Help them in making a choice to wear the right kind of clothes suitable to their condition. Before a patient puts on the hospital clothing, ask the patient to remove and keep all their personal clothing and jewelry, if any, aside. Instruct the patient to make a list of items that are being kept aside. Notify the relatives about the personal belongings of the patient. The nurse would also keep a record and provide the patient with a receipt of the items lists. Ask relatives to collect the patient's belongings and keep them in safe custody under the supervision of the nurse. Always ask the patient about the comfort of the clothes. If the patient is feeling too warm or too cold, ensure that you cover the patient with the sheets or cover the patient with a sweater. If a specialized type of a gown is being used to dress up a patient, check with the patient for the comfort. If the patient is uncomfortable, notify the doctor immediately and change the clothing. Tips on choosing and modifying clothing. Clothes should be comfortable and loose-fitting. Avoid back fastenings and tight-fitting garments if the person has limited movement of his arms. Clothes with front pocket is much more accessible if the person is sitting down most of the time. Velcro trips can be inserted in trouser seams if zips cause difficulty. Front fastening bras is useful for women with arthritic hands or recuperating after a stroke. Cotton is the ideal material because it absorbs perspiration well. Points to be kept in mind while dressing and undressing a person. Always preserve the person's modesty by not undressing him unnecessarily. Close the door and draw the curtains when undressing the person. Keep the room warm because you may take some time to complete the task. Encourage the person to do as much as possible himself to boost his independence and morale. Talk to the person to allay anxieties and embarrassment during the process. Do not rush through the procedure. Be gentle in your movements and pull the clothes, not the person. The most disabled limb should be dressed first and undressed last. For example, when taking out clothing, remove sleeve from the unaffected arm first as the person can bend his hand. Put on clean clothing by slipping in the sleeve from the weak side first. Make use of simple dressing aids such as dressing stick, long-handled shoe horn if available. Maintaining clothing hygiene. It is important to maintain personal hygiene of the patient with respect to the clothing to avoid any infection. As the clothes worn by the patient come in direct contact with the body, they may be contaminated with germs. To prevent any infection, it is very important to change the clothing of the patient and dress him/her with a clean piece of clothing. To do so, you must follow the given points. Change the patient's clothes every day. Items such as underwear, personal towels, face cloths, nappies are most likely to be contaminated as they come into direct contact with the body. So, change them every day. Change the clothing if it is soiled or stained due to the treatment. Procedure. Every patient's clothes must be washed separately. Ensure clothes are not shared between patients. During laundering, microorganisms may spread from one set of clothing or linen to the other, so laundry hygiene must be maintained. Patients must always be provided with clothing and gowns that are washed and that smell fresh and good. 1.5 Healthy habits. Habits are behaviors which are repeated over a period of time and difficult to change. Let us learn about some habits following which help the person to remain healthy. Taking bath daily prevents bad odor due to sweat and infections. Wearing washed clothes daily. Brushing teeth in the morning and evening after meals. Trimming the nails once a week and getting the hair cut month. Washing hands before and after meals. Eating regular meals and avoiding munching in between the meals helps to check obesity. Eating all types of food helps to get all the nutrients, avoids the deficiency diseases like malnutrition, less weight for age, and anemia, less hemoglobin in the blood. Eating freshly prepared food avoids food-borne diseases like vomiting, diarrhea etc. Consuming fruits and vegetables provides vitamins, minerals and antioxidants which are not only required for repair of damages in the body during diseases but also prevents many diseases and also some of the cancers. Avoid taking fast foods too frequently, you get more calories and salt leading to obesity and increased blood pressure. Always wearing chappals, shoes not only protects the feet from injury, but also helps to avoid worm infection. Maintaining good posture prevents backaches. Walking is a good exercise to tone up the muscles, lose excess weight and keep the heart healthy. Using staircase and avoiding elevators and lifts helps to keep the body weight in check. Sleeping and waking up early keeps you fresh and avoids tiredness. Contacting doctor at the earliest if you feel ill. Practicing yoga and meditation keeps the mind relaxed, prevents and checks diseases and maintains the balance in life. 1.6 Summary. In this unit we have discussed about the definition of health and hygiene. Concept of health, dimensions of health, factors influencing health, general grooming, principles while dressing and undressing, maintaining the privacy and dignity of the patient. Managing personal clothing and needs of the patient and health habits. Thank you for watching. We will see you in the next video with the next chapter.